Appreciate it. It's a Thursday evening. We really do appreciate your time. So we're not going to waste your time. We will get started in just a moment. But thank you for joining us.
There we go. We're in business. Let's go. Cool. So women's health, super, super important. And we wanted to discuss this tonight with you. As I said, we've had so many people ask the questions about what they can do to improve their women's health. And chiropractic actually is a really integral part of it, which we'll go into through the course of the evening. So we're going to kind of talk back and forth and hopefully you enjoy it. And like I said, if you've got any questions, put them in the chat or ask us at the end and we'll take some questions there. So we'll start off with this one.
So why are we discussing women's health? Well, I'm a little bit biased, but I think as a woman, I do think that we're pretty awesome. We give birth to new life. We are the integral for our communities. We make 80% of health decisions. That's one of the stats. So I do think the world wouldn't run very well without women. I know I'm a bit biased, but Tom agrees. And I probably would guess that many of you would agree as well, that we are essential to keep this world going. And I think sometimes, especially as a woman, when it comes to health, we're deemed as almost a bit of a problem, that we should expect to have issues as a woman, and that it's very normal to always have complications and have a complex health history, and it can almost make us feel almost a bit, takes away our power as a woman, and it can make our health choices and our journey in health quite difficult. So hopefully tonight will be of help to you. I've certainly experienced some things in my time that you wouldn't go through yourself. Men and women, we are equal, but we are very different as well. And I think it's important to acknowledge that we do go through different things, which are unique to us. So hopefully this will be of help to you.
And I think that statistic on 80% of families' health choices are made by women. It means that you really are the people who make all the choices on health, but oftentimes you're almost the sacrificial lambs in the health of the family, because we put everybody else first and then focus on ourselves. I call it mum syndrome with the people I work with, because you just sacrifice. And when we get into the stress shortly, we'll see why that's such a problem. So here's some stats that might shock you. Yeah,
so this is quite scary. So in the past, one of the quotes that was said from actually a gynecologist, there's no room for the womb in the tomb. So essentially, there's no room for the uterus, and the uterus doesn't really have a place as a woman within us. So a really shocking stat: every minute there's a hysterectomy happening, and only 1 out of 10 of those are for an emergency. So they're not always critical, but it's a huge stat. That's massive, and it has such an impact on women, and it could potentially be prevented with the right guidance at the start.
I think a huge lot of that could be prevented. And if you think that so put it like this. I know John's on the call as well, so I've got another man in my corner. If one man every minute was castrated, do you think that would be allowed? There would be uproar. And I think if one woman every minute is having a hysterectomy, having their womb taken out, it is criminal in some sense. And if we think that that area of the body, if we look at sort of Eastern approaches to health, it's considered the second heart. It's the second heart of a human body. It's the second heart of a woman. If you rip the heart out of someone, it has a huge emotional impact. And then if you think physiologically that it is a secondary producer of hormones in the body, so a huge producer of your hormonal balance taken away. The ramifications and the knock-on effects of health are extraordinary and very detrimental. Now, we know that some people on the call may have had a hysterectomy, and there is guidance information to help with that. But we can't just keep doing what we've been doing and expect women's health to suddenly improve overnight, can we?
Yeah, it's a scary stat.
So let's have a look at what we're going to talk about tonight.
So we're going to talk about this evening periods and focusing on what's classed as a painful period and normal period, but we're also going to focus on the menopause as well. So the women's health is such a broad topic. These are two key areas, but it really is, I suppose, the tip of the iceberg. So we will be giving you a little overview, but also some things to help yourself with. But this is really, like I said, an overview tonight. And our aim over the next year is to really go in depth with some of these topics, especially as I'm myself and Tom are learning more about it. And it's only right to share it with you, because the sooner you can start helping yourselves, then our health can only improve.
So I have no idea, but what is considered a normal period?
Cool. So what is considered a normal period is that there is to be some form of pain expected, for it to last around between 1 and 7 days. It's essentially the bleeding stage of our menstrual cycle. But yeah, what's associated and what's classed as normal is that there is always some form of symptom associated with a period.
So what kind of symptoms do women typically get? Like pain, cramping, sleep, sweating?
Yeah, poor sleep.
Emotional
changes. Yeah, so essentially some form of symptom that is likely going to involve some form of pain type relief to assist.
So I'm going to let Sarah tell you what a normal period should be, because you wouldn't believe it if I told you.
So a normal period, and I wouldn't have believed this if I had read it a few years ago, but essentially it's a time of our month which involves some bleeding between 1 and 7 days. It is a time where there hasn't been a fertilized egg, and essentially there should be no pain or any symptoms. The only thing that ideally should relieve something is as far extreme as using some form of heat. But essentially a normal period shouldn't involve symptoms at all, which is a shocker, because if you'd asked or mentioned that to me a few years ago, because personally I've experienced symptoms myself, I would have classed that as norm, because that's essentially what most people who I know would have experienced at the time as well.
And that's the problem with commonality and normality. Like, it's common to have these symptoms, but it's just totally not normal. And if we don't address it now, what cascade are we setting up for what we're going to talk about in a minute? Menopausal issues. Some other stats on periods.
So yeah, like there's no symptoms. The bleeding should be no more than or around 60 milliliters. So Tom's going to put that into perspective. You find a good
Find a good stat. So 60 milliliters. Can anyone measure out 60 milliliters? No. 60 millimeters is essentially so a medium weight tampon is going to absorb about 5 milliliters. So talking 12 tampons in a period is normal. Anything over that is excessive bleeding. And then the bleeding should just be quite pale, normal blood at the start, very, very few clots in there. If they are very small clots.
Yeah, the cycle should really be between 27 and 32 days in total.
And if it's anything over or under, that can indicate imbalances in hormones. So anything too short, progesterone can be too high. Anything too long can indicate testosterone, estrogen. So, anything else on that one?
Nope.
Cool. So there's two real reasons why we get issues with our period. One is to do with uterus position, and one of them to do is stress. So do you want to talk about uterus position?
No, I was just going to say, actually, one of the 95% of the population actually struggle with period pain. It's a massive percentage. So, and that's why I think it's classed as normal to have pain, because so many people experience symptoms. But yeah, that's huge.
It's huge. And why it would be considered normal. So if you think about the uterus sits obviously in the lower part of the body, and it sits just behind your bladder and just in front of the rectum. So it's meant to kind of, it doesn't attach to anything. So if you think you've got your, I don't know if you can see with this light, pelvis bone here, the uterus is sitting suspended in the pelvis. So in essence, it doesn't actually attach to anything. It's suspended like a hammock with ligaments that attach to your pelvis. Now, simple things like a full rectum can push the uterus forward, a full bladder can push the uterus backwards, too full can push the uterus up. We're meant to have a normal position of this uterus, but in poor alignment, we can have either what's called a retroverted, which means a uterus that's tilted backwards, or an anterioverted uterus that's tilted forwards. So the most simple way of thinking, maybe if you have an anterior or a retroverted uterus is think about, where do you get pain when you have a period? So when you've experienced period pains, where have you experienced pain? Front or back?
Front.
Front. So front is more normal, more common, and that's an anterior verted uterus, which is the lesser of two evils. A retroverted uterus is linked to a lot of problems, increased risk of endometriosis. That's where people get to get real dull lower back pain when they have their periods. And the reason for this movement forwards or backwards is imbalance in the sling, in those ligaments that are holding the uterus in place. So those of you who come and see us as chiropractors, one of the things we do is try and balance. So the pelvis looks like two hand bones. That's why I hold it here. We try and balance the alignment of this pelvis. Any misalignment can create torsion and twisting through that uterus, which will affect its function. So if you think one of the reasons you get pain is cramping at the time, if you've already got a torsion or a twist in that uterus, that cramping is going to be more severe. So that's one of the main reasons that we get problems with our periods, is due to the position of that uterus in place. The most important bone of all being the sacrum. Sacrum is that sort of tailbone, just above your tailbone. What things can cause people to have problems with the sacrum? Sitting?
Sitting too long, poor posture, just not being mobile, essentially. Yeah,
so immobility, poor movement, and sitting, which is modern day lifestyle, can have a real knock-on effect on how well that uterus moves. The other reason is stress, and that's what we're going to focus on a little bit more tonight, because this is stuff that you can work on. So, but hormonal basics. There are four main hormones when we're discussing women's health. There are more, and they sort of work in a cascade. Hormones are made initially in your gut, and the precursor to making hormones is fiber. So good fiber in the gut is going to be one of our tips. Fiber is where the first building blocks of hormones come from. The first hormone we make is cholesterol. You've all heard of cholesterol. You've all been told how bad cholesterol is. But if cholesterol is the precursor to every hormone in your body, do you think it makes sense that we don't have any? Or we try and reduce it? Cholesterol will then go on to make progesterone. Progesterone is that hormone that keeps us sharp, it keeps us clever. The corpus luteum, which is the start of the egg, that is what releases produces progesterone. That period in the cycle is often when women get a bit of PMS, but should be when women are most calm, harmonious, and clever and sharp. So if you're getting PMS, there's an indication that you have progesterone imbalance straight away. We then, from progesterone, make testosterone, which doesn't get talked about in women's health, which is essential because you can only make estrogen from testosterone. You can only make estrogen from testosterone, so you have to have testosterone. Testosterone is really important for your mood, your libido, and egg quality. And then estrogen is really important for things like your metabolism, the health of your brain, support of your immune system, and having an anti-inflammatory effect. So it's super important for your health. So we have this cascade of hormones that are balanced. But the problem comes when we get stress. But you had a fact on this, didn't you, before we go on?
No, just some names.
Go on.
No, so like progesterone, if anyone likes to watch the Marvel films, we can link these hormones because sometimes they're big words and we can't really remember what they are. So progesterone is similar to the Hulk. So it's Bruce Banner. So it's clever, sharp, and very calm. But if it's not in balance, and he turns into the Green Hulk, which can get very angry. And
I've never seen you like that.
And that's where the moods, impact of moods can come in, like you've mentioned. Yeah. There's a few of us, but there's escaped me. I'm sure you can help.
What's the late? Oh, I know.
Anyway,
so
we're wasting your time.
It's more essentially all of them are Jekyll and Hyde. All of them have polar opposites if you're in balance or out of balance. So this is where the issue comes. So stress, we all have it. We're all under it. Daily life is full of it. But the way the human body works is you should have a small burst of stress and then a period of recuperation and relaxation. We live in the wild, we should have a stressful event happen and then we all relax and we recover. But that doesn't happen. I mean, Sarah's just come back from a long day's work and she's straight up here to do this, and there's no stop, no stop, no stop, no stop. So when we get stressed, you'll see the top of this circle. This is the unhappy person who's stressed. Our stress hormone is cortisol. So cortisol then starts to increase. Cortisol has increased because of stress, but cortisol is really, it's a bully. So when it needs more cortisol, what it does is it nicks everything from progesterone. So it takes away progesterone to make more cortisol. And therefore your progesterone levels drop. Because there has to be balance in the body, if progesterone drops, estrogen goes up. What then happens is our thyroid function starts to reduce over a period of time. So how many women do you know with thyroid problems? Huge amounts. The thyroid function down for a long period of time will then affect the liver and the gut. The liver is a big producer of cortisol, and now we're in a spiral. And it just goes on and on and on. And if we came into any of these parts of the system and said, okay, your cortisol is high, so it's going to link into cholesterol going up, so we're going to take statins. We've never fixed the original problem. Oh, your progesterone's, your estrogen's high, so let's give you a hormone to stop this. We're never fixing the problem. You're having issues with your thyroid. Let's give you medication to affect your thyroid. But you go on thyroid medication, and then after a period of time, your thyroid function drops again, so they up your thyroid medication. And it drops again, so they up your thyroid medication. Never went back to the original cause, which was as simple as chronic stress. And that chronic stress pattern really starts to change the hormonal balance within the body, which then leads to out of balance hormones, which is the reason that we get pain and symptoms from our periods.
And just to clarify, if the issues with the gut and the liver, so that will impact the fibre, which originally makes the hormones itself. So
yeah, so you just
it's
perpetuate.
a conscious cycle, yeah.
So what can you do?
Quite a few things. I think it's really good to talk about this, because there are lots of things we can do. I think sometimes it's deemed as being a bit out of our control. So if we start with the first one, this is not necessarily something you can do on your own, but this is essentially a uterus lift. This is an external uterus lift, but it is something that as a chiropractor we can do with the correct training. But essentially even just getting adjustments, focus on the pelvis, like Tom spoke about, can really just help rebalance how the uterus is sitting. So that is really key. Some supplements that are key to help, so magnesium, vitamin D, omega-3, essentially to help reduce inflammation. Magnesium's great to help relax the muscles, and will assist with those spasms. I'm assuming that's what it's referring to.
Yeah, and really good studies have shown that omega-3 is just as effective as ibuprofen. Just as effective as ibuprofen for menstrual pain.
Yeah, so upping it if you don't take it, but ideally take it consistently, but also upping it when you're near to your cycle would probably be a beneficial thing. Mm-hmm. What we consume will really impact how our body is functioning underneath. So gluten and dairy, they just essentially make our body work harder underneath the surface, so it increases that inflammation. And if our body is inflamed and working super hard, essentially it's going to add to the stress within our body, so that will have a big impact. And the fibre, which Tom spoke about. So when it comes to fibre, lots of like fresh vegetables is the ideal. So that will really get some good natural fibres into your body and help with the hormone cycle. Yeah,
I think the main point, and we're going to move on to menopause now, but the main point is that the symptoms from a period are not normal, and they are rectifiable for the vast majority. And it's simply that the body is out of balance. You know, we right back at the start, we treat women's health as a medical emergency or something that needs fixing. And it's not the case.
I think with this, just speaking from experience as well, I've really struggled with period pain for many, many years. And I really notice it I know we are all individuals, so we are all unique. So I'm not speaking on behalf of all of us, but personally, when I have been eating in the wrong foods and like my alcohol intake have increased, I've really noticed the difference in the comfort of my periods. And certainly over the last few months, since I've been a bit cleaner with my diet, I've massively improved. So yeah, it does help. It just takes a little bit of time to get your body used to it.
So if we move on to the menopause, which is essentially an extension of what we said, but a little bit more detail. So
so the menopause, it's seen as and I can't speak from experience with this one, but it's seen as a time where, well, almost a negative, like it's got a negative connotation linked to it. So a time that we should almost all dread. It's a time where what's classed as the normal menopause is when the period begins to stop, when we start to have mood swings, gain weight. So essentially have lots of different symptoms which aren't very nice for us. And as it says there, where our cycle changes and it starts to become heavy as well. So it hasn't got the nicest, I don't know what the word is.
Dry up and finish is what a lot of people sort of say. And it's not true. And if I was to say to you what a normal menopause would be, you would not believe me. Again, the same with the period.
So essentially with menopause, it should be the time when our period stops, and it's only diagnosed after it's stopped for 12 months. So it's retrospective rather than being at the time. And in tribal cultures, it's actually been described as a time where it's almost a rebirth, because we're getting different type of hormones and new hormones released. It should be really deemed as a joyous time rather than something to dread and wait for.
Yeah, I think the Western world values youth over wisdom. And I can't say we, can I? As women move into the menopause, it's a time where they really should be respected by the community and moving into wisdom. Self-nurturing is the biggest part of it. It is a retrospective diagnosis, 12 months, no period, no symptoms. No symptoms. And again, we'll talk about why, because it sounds like a bold statement, especially when the narrative is completely contrary. The reason for this change is the fact that obviously the ovaries are stopping. Well, they're not stopping, they're just changing their function. That last egg has been released, and therefore there's no need for the cycle anymore. So the ovaries change function, and the ovaries are the second sort of producer of those hormones. That's no longer happening there anymore. And the adrenal glands are what now have to take over. So the adrenal glands take over your hormone production once you finish your menstrual cycle. But the adrenal glands are where we process stress. So if we're under a high load of stress and now we're asking our adrenal glands to produce our sex hormones, we're really going to struggle. Say you're running on a treadmill and you're running fine, and now I give you a bowl of soup to eat, you're going to really struggle to eat it running on the treadmill. And it's the same thing. Your body's already at capacity because it's so stressed. And now you're asking it to do more in one particular area in the adrenal glands. So the main focus for helping is working on adrenal balance, which is stress balance. And the reason this can be, and Andrea has helped us with this talk, she talks about this can be springtime for your life. It can really be a springtime for your life, because what happens here, instead of your hormones being cyclical with your cycle up and down a little bit all the way around, they now have the potential to run at a relative constant. That progesterone that gets released with the corpus luteum once a month, which is meant to make you Bruce Banner, now has the potential to be omnipresent, there all the time. The fluctuations in mood and symptoms purely come because we haven't got the hormonal balance, not because it's just what happens when we have our menopause. And it comes again back down to this. If you've got stress already happening up here in the adrenal glands, instead of the sex hormones, which would work down here with progesterone, estrogen, they're having to be worked up here again. It's more stress load. And if we think about what imbalance means and what we actually see, if you're say if your estrogen's out of balance. If your estrogen's out of balance, it was very immune protective. So we're starting to see things like repetitive thrush and candida infections, the weight gain, that change in weight distribution, pain. If our progesterone's out of balance, things like breast tenderness, water retention, not pertinent for menopause, but also if our progesterone is out of balance, that's why people can miscarry early quite commonly. And testosterone linked with hair growth, acne, and weight changes. So all of these things, or most of these things on here, are commonly associated with menopause. They are not due to the menopause. They are due to the hormones being out of balance because the body is already overloaded with too much stress. And the simple thing to take away are really the 5 S's of hormonal imbalance. The 5 things that can really create hormonal imbalance. Stress, emotional stress. So it's really a time when women need to honor themselves and make sure that they are the priority. That mum syndrome thing needs to go out the window. Because if we really take the ramifications of this and we really expand it, hormonal imbalance for a long period of time is very serious to somebody's health. Precursors to things like cancer and such will in the future. It's really important that we take ownership of our own health now. So you have to become the priority. If we're making 80% of our family's decisions, is a woman going to make better decisions as Bruce Banner or as the Hulk? So if you knock that on and you want to do the best for your family, being selfish and being Bruce Banner will actually serve your family better in the long run. Do you want to talk about any of those?
You go ahead, I'll add in.
Cool. Sugar, huge toxic stress to the body. So we really must reduce sugar at this time. Subluxations, so those misalignments in your spine that we adjust as chiropractors, that misalignment in your pelvis. If you've got chronic subluxation, so interference in that nervous system, how your brain and your body is talking to each other, it's going to put your body in a defensive position, a defensive mechanism, which is why we measure that at the practice.
Yeah, it's really cool. Often people come for, I don't know, might come in for neck pain, but on their history form, it might say that they've got like menstrual issues or various other issues. And it's amazing to see after a period of time, and this is not to say that we can cure these issues as a chiropractor, but it's amazing to see as the body starts to function better, how many people put on their Progs exam forms that like their periods are more comfortable, their bleeding's less heavy. And these are all things that weren't the primary issue as to why they're coming in, but it just shows that as the body does start to function better, things do start to regulate, which is really cool.
And that comes back to the top of the talk again. The natural state for a human body, male or female, is healthy, is to be well. It's not to be sick. Sleep deprivation, big issue with hormonal balance and synthetic hormones. So, you know, taking any sort of hormone replacement stuff, synthetic hormone replacement actually will damage the hormone balance long term. You need to get bioidentical hormones if you are getting a hormone replacement, which is unfortunately not done very often. So things we can do to help ourselves, simple stuff again.
Caffeine and gluten. Caffeine.
Glad I'm not ever going through menopause.
Yeah, Tom's a caffeine fiend, but yeah, reduce estrogen.
Yes, so caffeine and gluten have a direct knock-on effect of reducing estrogen in the body. So it will really hamper that hormone. Obviously, we talked about fiber because that's where we produce cortisol at the start, that first precursor for all the hormones coming after that.
Yeah, protein and movement. So it says there, protein to help rebuild. So we need protein to help rebuild our body, but also movement to get our blood and everything. Movement's key, especially get that sacrum moving as well and get our pelvis working right. That will really help with that. Breath work. This is why if you are joining us at EPOC, why we do the heart rate variability test. So it's the one that clips on your ear and you get a 3 minutes of blissful peace. The reason we do it is because it measures how your body's function underneath the surface, and doing all these little things here will really help with that. Essentially, the higher it is, the better the score, the better your body's functioning underneath, and it just lets us know that your body has got that adaptability to respond to stress, but also return to its norm at a reasonable pace. So breath work is one of the tools that we recommend. And for the menopause, that it says there, it helps to reduce, or shown to reduce, hot flushes by 40%. Can you give a demonstration of a breathwork technique?
Oh, I can. So it's essentially your breathing cycle. You split into 4 parts: the breath in, the hold, the breath out, and the hold. We've pretty much done this on every single webinar we've done. It's that important. And each one of those cycles you hold for 4 seconds. So you breathe in slowly for 4 seconds, you hold for 4 seconds, you breathe out slowly for 4 seconds, and then you hold again for 4 seconds as I go into teenage adolescence and lose my voice. So it's a 4-second cycle, 4 stages of the breath cycle. Really, really important for that. Some supplements, vitamin E and magnesium, and then obviously stress management. Prioritizing you is so important at this time. And then obviously chiropractic as well. Anything else on that?
No, when it comes to breath work, I just said no and then talk. When it comes to breath work, even if you do it in the shower, or because I know often time is an issue, on your drive to work, on your commute to the shop, it doesn't have to be, ideally, yes, sit in blissful peace, but if you just do it on your normal daily routine, if you're making like prepping lunch or boring stuff that you have to do, focus on it then, because that will really help as well. So just try and incorporate it easily.
Cool. So I think the main things to take home from what we've been through is that women's health is women's health. It's not women's crisis. Pains and discomforts and symptoms are not normal, and they should be addressed, and for the vast majority can be addressed quite simply. I think women need to honor themselves more and take ownership and not necessarily, well, yes, take responsibility, but put themselves first. And I think that will have a dramatic knock-on effect beyond that. Simple lifestyle stuff, it's nothing dramatic, it's just simple stuff. Over a long period of time will have a huge impact and a huge effect. Do you have any take-homes from today?
Yeah, to be selfish. Be selfish. It's easier said than done. I don't always put myself first. I'm trying to get better every day at that. But I think sometimes our health is definitely put on the back burner. But I think we deserve to thrive as women, and we do a great job, and we deserve to enjoy our time on this planet. So
true. So we will take questions, but just before we do, I just do want to mention Andrea. Many of you are struggling. I pointed you in her direction. She's been very gracious and kind to help us with this talk. She's not a small fish in the women's health world. She really is one of the world's leading experts on women's health. We're very blessed to know her. She has a lot of information. She does consult privately for some of our patients as well. So if it's something that you do need to look into further and we can't help you, we'll point you in her direction. And obviously she's got a podcast with a whole plethora of resources and information for you, free at your fingertips. So that's her details. Does anybody have any questions or comments or take-homes from today? You can either type it in the chat or you can just unmute yourself and go ahead and speak. Does anybody have any questions or comments from today? It's going to be another one of these simple ones.
Yes, I will.
Go for it, Joan.
There you go. Sometimes these things are out of our hands.
Mm-hmm.
I have been blighted and suffered with, and I mean suffered, with hormone imbalances all my life. And the reason for that is because I have a bicondylar uterus. Do you know what that is?
I don't.
In effect, I have a uterus and a half. I've had hormone imbalances all my life, right through teenage years, right up beyond menopause. Because of hormone imbalances, contraceptive pill, whatever, didn't suit. And after the birth of my second child, I had an IUD fitted, which was fine for a couple of years until the egg decided to implant itself in the other chamber.
Mhm.
And despite having an IUD, I had a third child at the age of 37, 7 years after my second child.
Mm.
After that, I had a sterilisation op because it was the only thing that could solve my hormone imbalance, which started again when I went into menopause and onto HRT. I had to come off that because the same symptoms started to recur. I'm all right now. I'm fine.
That's quite fascinating. Thank you for sharing that. And my contention would be that the majority of focus of the health profession should be on those cases like yours, not on the normal stuff, which could be fixed quite easily. If we put our resources into helping people who do have congenital differences, it would be far better used than, tarring everybody with the same brush and the same approach. And that is where, if there is more going on, that there is a place to seek advice and help, and different from what we've said tonight. But for the vast majority, we shouldn't be tarring with the same brush. The resources should be focused on people like yourself. Thank you for sharing. That's fascinating.
Thank you,
I'm going to look that up. Thank you.
Do it's quite interesting. Well, it's interesting if you've got it, but perhaps not so for those who don't. But it has been a significant problem right through teenage years and many years beyond.
Thanks for sharing.
Yeah, and with this, the medical profession is amazing for certain things, like for emergencies and for cases like yours, Joan. It really is amazing, but and we don't want to take that away from the medical profession either. We're not saying that we can cure everything by vitamins and things, but there are a lot of things proactively that we can do to help our body function better. So yeah, thank you.
Any other comments or questions? I see Anna. Yeah.
Hi. Yes, Anna.
Hello. Go ahead.
It's quite interesting because when I heard about it first time, I thought, oh, life, what do I do with menstruation and all that stuff? It's been a long time ago when it all finished, But it was very interesting for me because I'm one of those women who had endometriosis and really suffered from it and didn't know. Doctors didn't have a clue for 20, 30 years. They just thought I had a tummy aches with something wrong there. Anyway, we sorted it out. I had a total hysterectomy. Okay, it was a bit late, like I think it was in my 50s, so at least it was this sort of menopausal times. Anyway, but I was also working for NHS at the time, and strangely enough, I was doing this research on intake of HRT, which at the time had a terrible name. According to what you're saying, it's no good anyway, but that's another story. But it had a very bad name, so I stopped taking it. I had hot flashes, I had it all. And I must admit it settled down a bit, but recently I've heard that the HRT, it's good really, but it doesn't have, still is not, no one told us anymore after the bad name and the breast cancer. That was the thought 15, 20 years ago. And what's happened, I decided to try something with doctor. And again, you are stuck with estrogen when I really need 3 of them. And like I say, I'm forgetting about what you said, that I can't remember how you called it, but the hormones which are
too.
no, you said something that they are not good for you either.
Yes, the synthetic hormones.
Synthetic, that's the word you were using. Yeah, but which perhaps what I'm getting is synthetic, But anyway, at the same time, we're talking about the GP can only prescribe estrogen, then you have to see consultant and hopefully can get the other things, which I don't have. Perhaps I'm not producing. So it's all a bit complicated, but it was very interesting to see some information which I wasn't aware of.
Thank you. And I think with that, it's very common sort of in the initial stage of HRT that we go to our GP and they say, okay, well, estrogen is low, take an estrogen. But remember, estrogen and progesterone have to balance. So we have to get full analysis done of our hormone balance. Start with the stress response first and see what we can do to help boost our adrenals. So magnesium, vitamin C, vitamin E to really help get the adrenals working properly so they produce the hormone. Have enough fiber so we can get the building blocks for cortisol to go on and build the hormones. And then if we're still not producing the right ones, that's when we can start to supplement the hormone, but with what was the word? With a bioidentical hormone. And unfortunately, you have to push hard or go private to really get that kind of analysis and help.
Yeah, well, you're completely right about it. In a way, I'm very lucky because my stepdaughter, who is quite young, only in her early 30s, she had a total hysterectomy and she knows more about those things than me. So she's giving me a lot of advice, but what I've done, I think my diet is quite good and I'm doing a lot of other things you were talking about, like breathing, and I'm doing it on a daily basis for a year now. And I'm sure I improved all sorts of things in me. And like I say, I'm not taking vitamin E. I wasn't aware of it. So I need to look into, I was just looking already online straight away. But I'm also asked to see consultants. So let's hope when I'm seen by consultant, they will do that check. Yeah. Whatever you called it. But it's interesting. I mean, like I said to you, I'm not a medical, but I worked in IT in NHS, and I work very closely with GP practices. And I must say that it's a constant fight, and it's even worse now than ever, which I'm very aware of. Anyway, that's just my little input.
I really appreciate that as well. And be sure to look at Andrew's stuff too. I think she'll help you with her free resources. Have a look at those.
Oh yeah, is that
it's on the screen now?
You can see. Okay, thanks so much.
Thank you. And Rachel, thank you for your comment. Really appreciate that. It's really worth doing, actually. The replay will be sent out to you, the recording. So I'm actually just going to stop the recording now. Does anybody have any other questions for us? Any other questions?